Thank you, everyone. Thanks for attending. I just want to thank everyone for coming. This is actually a really great topic to start off 2024 with wellness and just talking about everyone's well-being. So what we're going to provide you today is actually an interactive experience as well as an educational experience on well-being and self-care. Ruby, let everyone know who's presenting today. But again, my name is Allison. I'm a wellness specialist in PFCC. Natalie is here from Employee Wellness. She's a program director, as well as Nancy. She's our holistic nurse specialist, and Cynthia Vardero, who is also a program manager at PFCC. So I'm just going to start with Natalie. I'm going to bring Natalie up, and she's going to talk a little bit about well-being.
Thank you. All right, awesome. Thank you, Allison. Appreciate it. Hello, everyone. So glad to be here with you all today. This is my world, right? Wellness. I do this every single day. So it's always an honor and a pleasure to share this knowledge with you guys today. So let's dive in. So at Northwell, wellness is at the center of our strategy. It's very important to us. It's literally in our name, Northwell. So you'll see here, total rewards and well-being is part of the overall strategy of being a great place to work for all. That is our mission. That's what we want you guys to experience. And we know that that is multifaceted. So my world, again, is employee wellness. And so I'll share a little bit more about our vision and mission. Basically, we want you to be healthier because you work at Northwell. And we want to make sure that not only you're healthier, but your families and the community that we serve. So our mission is to raise the health of team members and equip them to advocate and advance the well-being of their families and their community. So you can take all this knowledge that you're receiving here at work and everything that you do, and you're taking it to your families and to the community. And we want to see the larger community be healthier and experience good well-being. So we wanted to also highlight the fact that we, of course, do these employee engagement surveys every single year to sort of get the pulse. Are we the great place to work? We also include wellness questions every year, and we look at the results from those wellness questions. And so I just wanted to share a few with you today. So in the engagement survey, we saw that 75% of team members felt that Northwell cares for their well-being, which is excellent. 70% feel like Northwell supports them in balancing work life and personal life. And 84% feel like their manager cares for their overall well-being. So we're really happy with these scores, and we want to see that continue. You're going to continue to see those well-being questions asked, and we're always looking for feedback on how to improve and address all the needs and concerns. And we saw that year that the top 3 concerns were financial, emotional, and physical well-being. And so I'll dive a little bit more into those topics in a bit, but just know that, again, we have a wealth of resources to support you in every aspect of wellness. So at Northwell, of course, we are a large organization. There's so many of us, and in employee wellness, there's only 8 of us. So how do we actually make the impact that's needed? We have amazing partners, whether it's on site or just our partners at corporate. That is really how that information and those tools and those resources become available to you. And so we just have here just a little graphic that shows that we tap into our wellness liaisons and champions, making sure that we have a site presence. Of course, we look at the engagement survey. We also look at trends from our EAP cases, and I'll talk a little bit more about EAP in a bit. And then again, tapping into our partnerships, whether it's, with Employee Health Services or HR or the Center for Trauma, Stress, Resiliency, and Recovery, et cetera, et cetera. But my wheelhouse and what we do in employee wellness, these are sort of our core offerings. So if you ever see any of these offerings, just know that it's coming from our team. And we, of course, partner with folks on the site to bring these to you where you work. So from an engagement perspective, we want to make sure that we're creating a network locally that can serve you. So Allison is your wellness liaison, for example, and every site has one, every service line. And from an education perspective, we actually host monthly workshops on a range of topics. For example, January, we have some great workshops on financial well-being, retirement. There's one on fulfillment, just, how to setting goals and that sort of thing. So every month we bring in external speakers or internal speakers and really tap into their knowledge so that you can get some really relevant topics for you and hopefully, the stage of life that you're in. And then from an accessibility standpoint, we want to make sure that you can actually access these things. So of course, in the age that we are in, thankfully, there are some benefits to Teams and things like that to increase accessibility. But we acknowledge that, of course, this is a 24-hour business, and we want to make sure that folks from different shifts have the opportunity to also tap into these resources. So we have YouTube channels, we have newsletters, we have on-site presence, we have some apps as well. I'll dive into those, but again, accessibility is very important. And then from a holistic standpoint, we want to make sure that we're touching base on all the core pillars of wellness, which I'll touch on in a little bit. But our core programs at Employee Wellness include My Wellness, powered by Virgin Pulse, Northwell Healthy Choice, My Healthy Body. We do a lot of site activations and give away nice, fun goodies. We have our breastfeeding support policy, EAP, our caregiver berg, and our financial well-being programs. So how do we actually help you guys navigate these resources better? There's a lot that I'm sharing with you today. So how do we begin to message that out? So this is just a snapshot just for your awareness of the folks on my team in Employee Wellness, as well as our key partners. So that includes Employee Family Assistance Program, Chaplaincy Service, and the Center for Trauma, Stress, Resiliency, and Recovery. So just note the central column, that's where we are. We're in the central region. So at the top, you'll see my name, and then at the following, you'll see the relevant contact person for each of those programs. So feel free to take a picture. If not, I do have a flyer in the back that has a QR code that'll bring you to our landing page that has everybody's information so you can reach out to us. But again, we just want to make sure all areas are covered, and those are the folks that you can actually pick up a phone or and call and speak to, which is really important, especially with wellness. We don't want you to just find the nebulous number and not know who you're calling, right? These are the folks that can help you. We also have I'm going to take this off because it's becoming a little hard to talk. With Northwell Connect, which is our new intranet page. This has actually made sharing wellness information a lot easier. So you see here that our resources and our programs are broken down by the pillars. So we have physical, emotional, financial, and social, spiritual. So hopefully you guys have navigated through some of these pillars, checked out some of the programs. Again, this is a more exhaustive list of everything that we offer from the benefits side, from every aspect. So it's not just what Employee Wellness provides. And it's just a great resource for you to find the links and the numbers and all these and how to access these different programs that fall under those pillars. So from a total well-being perspective, what do the pillars really represent? So we have physical, which is not just about staying active. It includes staying active, but it's also family planning resources, welfare benefits, nutrition, etc. That encompasses our physical pillar. Then we have our emotional pillar. So how do we navigate through tough moments in our lives, crisis support, stress management, substance use prevention, and smoking cessation programs all fall within that pillar. And then we also have the financial pillar. So how do you make wise decisions when it comes to your financial obligations and support securing your financial future, as well as paying for education, financial planning, etc. We have our spiritual pillar next. How do you find hope, meaning, purpose, connection? Our chaplaincy services are a great connection point for that. And then finally, we have our social pillar, which means really just connecting with one another. It really helps us feel good, and it supports all those other areas of well-being. In some ways you can engage with that is through the Bergs, through My Recognition, Northwell Life, all those fun things. So let's dive in a little bit further to understand some of the resources and programs that I mentioned earlier. And if you take anything away from today, these are just like high-level points. So we'll get into it. And those of you who are joining virtually, you can scan the QR code to access these. But really a top priority, I highly recommend you do this. Just download the Virgin Pulse app. That really just brings all of the resources that I'm mentioning today at your fingertips. And yeah, it's obviously a great way to stay connected and tap into that social pillar. But we also know from a behavior change perspective, how you track your behavior is going to lead to more success. So again, it's just a great resource to have, and it's right at your fingertips. Next, we recommend that you register for My Healthy Body program. I'll dive a little bit more into that. We recommend that you request a workshop for your department or team. Anybody can do this. You don't have to be a manager. So I recommend you consider that. I recommend that you join a system wellness workshop. As I mentioned, for January, we have a really excellent lineup, but there's always really awesome, relevant topics from really knowledgeable speakers. Next, I recommend you try the Healthy Choice menu items or use one of our recipes from our Healthy Choice cookbook that's available on Northwell Connect. And promote and utilize Employee Family Assistance Program. I'll talk more about that. Utilize chaplaincy. And if you want more of an experiential offering, I recommend you also check out the Center for Wellness and Integrative Medicine. And you guys are lucky because you're probably the closest site to them in Roslyn. So if you haven't already, I recommend you checking that out. I'm gonna just grab. Oh, sorry about that. I was sick last week, as many of you guys I'm sure have heard. So my throat is a little dry. Okay, so for My Wellness, powered by Virgin Pulse, just diving a little bit more into it. As I mentioned, it is a total well-being experience. Has anybody participated in our Walk 2 challenges? Yeah, so many of you then are probably familiar with Virgin Pulse, and you know that it is a personalized experience. If you take your health benefits through Northwell, that is also how you unlock your well-being credit program. So you actually do complete your health risk assessment on this platform, and that is really what unlocks those wellness pledge credits so that you can see that money in your paycheck. You also receive daily tips based on your own interests. You can track healthy habits, including mindful minutes, steps, and a lot more. We also have this newer program called Rethink Care, and it's a mindfulness program. So if you're really into those like mindfulness apps, that's essentially our version of it, available in Virgin Pulse. And then, of course, as I mentioned, we have our system Walk 2 challenges, and you know, hold tight to find out where we're going this year. It's a really exciting one. So I'm going to be excited to come back and talk to you guys more about that when we announce it. Next, we have My Healthy Body, which is our program for strengthening your musculoskeletal system and preventing injury. And what it is it offers you customized educational videos on how to, again, prevent injury, strengthen your muscles, and the different tiered plans that you can join through My Healthy Body include the prevention plan or the recovery plan. The prevention plan is going to be for if you're not dealing with any active aches and pains and you just want to make sure that you're strong, you're flexible, you're healthy, you would do the prevention plan. And again, the exercises are extraordinarily simple. They're essentially like stretching videos and stretching demonstrations. They feel really rejuvenating. And again, it's really good for your body. For the recovery plan, that's if you're dealing with active aches and pains in the body. So if it's lower back pain, maybe you woke up with a crick in your neck, knee pain, whatever it is, if you're actively dealing with pain, you can join the recovery plan. And again, it's essentially going to give you physical therapy like exercises that can really like mitigate that pain and help address you know, the aches and pains in your body. And also, depending on how you score in your assessment on My Healthy Body, and for example, like say if you're dealing with acute pain, you can then receive a referral to our STARS rehabilitation service line to sort of expedite an appointment, which is really great because typically, of course, you know, we have to go to a doctor and then get the referral, but that sort of cuts that out, and it can sort of expedite the process if you're dealing with acute pain. So again, really great platform to know about, and I recommend you checking it out. There's also some just great resources on tips on, for example, like the right walking shoes and the right posture, ergonomics, that sort of thing. That's all on there. And then we also have a library of 5-minute pre-recorded stretching exercise videos, and they focus on different target areas. So again, it feels really recharging and replenishing. So I recommend you check it out and do some of the exercises. Oops. Next, we have the Northwell Healthy Choice. So hopefully you guys are not unfamiliar with that icon there at the top right. You hopefully see it in your cafeteria on the menu as you walk into the cafeteria, and hopefully in the display cases. That little apple indicates that it meets the Northwell Healthy Choice guidelines, which means that essentially we want to make the healthier option the easier option, right? You don't want to have to think. You just left the floor. You just want to quickly grab something, look for the Apple icon, and just know that we've already done the guesswork for you. It is registered dietitian approved. And we want to make sure, again, that it's not only accessible to you guys, but also the community, as well as on our patient menus as well. Just know that those standards are across the board. We also offer seasonal cookbooks through our Healthy Choice program, which you can check out on Northwell Connect. We offer community-supported agriculture or CSA options locally, where you can get fresh vegetables delivered to your work site. We participate in National Nutrition Month every year in March, and we typically do a fun challenge, and we give out extra giveaways and stuff, so look out for that. And then just from a nutrition services perspective, if you need guidance on finding a registered dietitian, finding a weight management program, maybe you're dealing with diabetes, pre-diabetes, whatever it is, we offer guides on how to access these programs, because of course, as Northwell employees, we have something for all chronic conditions that you might be dealing with, or maybe a benefits dependent of yours. If they're also dealing with it, many of our programs are also available to them. And then from a social perspective, we have this program called Northwell Unlonely Project. And it was started in 2020. It happened to be before the pandemic, but it ended up being very appropriate. And essentially what this initiative is to reduce the burden of loneliness and its stigma. So really under this initiative, we want to promote awareness, provide programming, and a reduced stigma. So the two programs that we offer that anybody can request and do include Front Row, which is where you get to watch a film. It's a short film and have a conversation. Simple as that. But it's just a great way to connect with one another. There's some really powerful themes behind a lot of these films, and you get to dive into it and just relate to one another. And it's just a great conversation starter and team building exercise. So I highly recommend you do this virtually, in person. It doesn't take long. It's like 30 minutes. So that's an option. Next, we have our creativity circle that's also offered, and it's really an art-based group that you do. It's an hour long, and you don't have to have any prior artistic experience. It's really just for you, again, to connect with one another and use creative arts as a way to connect with one another on a deeper level. So if you are interested, you can scan the QR code if you're online, or check out our flyer in the back. And now we have our Employee Family Assistance Program, which is, or EAP for short. It is a benefit that is offered to you. Doesn't matter your employment status. You can be union, non-union. It's accessible to everybody 24/7. And what it offers is short-term counseling and consultation services by a New York State licensed behavioral health provider. And they really do help team members and their eligible family members navigate through life and work issues. So anything you might be dealing with, whether it's divorce, maybe it's a teenager, maybe it's death, grieving, it's a wonderful resource to connect with and see what's available for you, whether you're looking for a therapist, or maybe, again, you're looking for a short-term counseling service. You can call them up 24/7 and they can help support you with that. So again, it's a great number to have in your phone. I recommend just saving it in your phone. You never know when you'll need it. That's life, right? You never know when you'll need help. So I recommend just saving that number for yourself or for a colleague or for a family member. We have our chaplaincy service. So the chaplains, I'm sure you guys are aware of them. They're not just for the patients, they are for you as well. And so they do offer two wellness programs. We have our heart-to-heart session and our inspirational call line. With the heart-to-heart session, you would speak to a chaplain, and it could be about anything, literally anything on your heart. You want to vent, something's upsetting you, or you just, maybe you're dealing with grief, whatever it is, you have a listening ear from a chaplain. And of course, it's confidential, so you can call that number and get connected to a chaplain. And then we also have our inspirational call line, which is a recorded message and it's updated every week. So it's oftentimes like a poem or just an inspirational message of hope, which, we all need it every now and again. So if you're looking for something like that, I'd like to think if you're a journaler or if you're into like mindfulness, those are also just great prompts. So again, it's available 24/7. You can call the number and hear an inspiring, thoughtful message. So yeah, that was a lot of information, and just know that we're really here to support you and cover every aspect of well-being, all the pillars. So if you have any questions, I'm going to be here for the remainder of this event. So feel free to come up to me. My contact information again is in the back, and I'm happy to assist you. All right, thank you.
That was awesome, wasn't it? I feel like I know so much about the employee wellness and all the offerings, but I feel like I got a lot more to investigate now after that. That was a wonderful, wonderful presentation. So my name is Nancy Mashani. I guess I'll stand here.
Yeah.
And I work for the Department of Patient and Family Centered Care as a holistic registered nurse specialist. And today we're going to be doing some experiential, since this is all about self-care. We're going to be doing some 2-minute self-care techniques. I know on the virtual pulse, the 5 minutes techniques. We're just going to do 2. And I know a lot of you have already done these with me and have done them with your families and then brought them to your staff. So I think you're going to really enjoy this. We're going to be standing for part of this, but I'm just going to start off by talking about our lovely Jean Watson, our nursing theorist. So we got some Jean Watson fans in the audience. Yeah. So Jean Watson's theory of caring is really the underpinning of all professional practice throughout the entire Northwell system, not just here at North Shore. And her caring theory talks about, caring for oneself as a prerequisite for caring for others. So we really need to do this self-care so we can continue doing our jobs and doing the work we're meant to do. So thank you for the Jean Watson cheer over there. And most, if not all, self-care and relaxation practices start with the breath. So sometimes in the moment, if we just take a pause and just notice the breath, you don't have to change it. You don't have to do anything fancy. Just start to notice. It's quick, it's simple, it's effective. It's going to evoke a relaxation response, put that stress response at bay, and it's very practical and easy. We're all familiar with the stress response, and we want that to kick in when we're running to a code and we're going to a crisis, but we don't want to hang out in that all the time. So we just tighten up, we flood our adrenals. Everybody knows this. And I'm sure you're also familiar with the relaxation response. So today, we're going to practice several 2-minute, might even be less, techniques to improve our energy, improve our sleep, our coping, balance our hormones, the whole thing. We just want those endorphins and serotonin to flood. I was actually on one of the units before I came down, and one of the nurses said to me, "Oh, I can't wait. I got to be doing it on Teams though." And she talked about a technique that I had done with her and the staff to evoke some relaxation. She said since she does that, she does it at night and she can fall back to sleep. And then somebody else was talking to me just today about going on TikTok when they wake up. I'm like, yeah, that can distract you from your thoughts, but maybe go into one of the Virgin Pulse apps instead and see if you can evoke a relaxation in a different way, not just a distraction. So we're going to do those today. The first thing we're going to do is a Qigong practice, energy. My heart and soul is in Chinese medicine and energy. Energy is all around us. It makes our heart beat, right? Takes care of our emotional well-being, and it's everywhere. Everybody knows you can walk into a patient's room and that family member could be there and you just feel that energy. You walk on a unit, you know something's going on because you feel the energy. So we're going to work with the energy a little bit today. And if you want to experience energy, put your feet on the floor for a sec. Notice your breath. Just feel it. Bring your hands together and just rub them. Rub, 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 rub. So Qigong is the practice of working with Qi to affect your emotional, spiritual, physical well-being. Now, just gently move your hands apart just a little bit. That's your Qi. Maybe you feel something, maybe you don't. If you don't, it's okay. Maybe you feel magnets, clouds. Anybody? Feel something? So we're going to take that Qi and we're going to use it. There are 3 tenets. I already talked about the breath. What? Laughing back there, what'd you feel? Come on. Tell us what you felt. Yeah, right? Yeah, yeah. Everything here is normal. So we're going to talk about the breath. And during this practice, you're just going to notice your breath. If you have a particular style or practice of breathing that you want to do, go ahead. But otherwise, just slow, gentle, deep. We're going to notice our posture, and I'll talk you through that. And we're going to notice where our mind is. Is it here in this moment, or are you thinking about something else that you have to do in a half hour from now? So we're going to do a warm-up. So stand up if you'd like. You don't have to. Make sure you have enough room around you because we're going to swing our arms forward and back. You go in the back of the room, you go side to side. I just don't want you to hit anything. So take your feet like shoulder width apart. Doesn't have to be big and wide. Unlock your knees. So when you're standing at the nursing station, when you're at a bedside, unlock your knees. Bring your pelvis down a little bit. Let your breath flow. Feel the crown of your head to the heavens. And just swing your arms. So you can do this at a puddle, right? Just start getting the energy flowing, right? If this feels good, when your arms go forward, your head goes down. Arms back, head back. If that's too complicated, don't do it. If you feel the flow, open your chest, breathe, inhale, exhale. Come up on your toes and clump down a little bit. Feel the energy going up your spine. You can let go. Good. Now we're going to swing side to side. Loosening everything up. Breathing. If your arms are nice and free-flowing, go ahead and turn your head in the opposite direction. Engage your brain a little bit. This could be a little challenging, but if you can't do that, that's okay. It took me a long time to do that. And if anything, it's going to make you laugh because if you can't put your head in the opposite direction, you'll be like, what is wrong with me? And it'll evoke some laughter, which is good medicine also. Now we're going to do a spinal twist. Just twist. Just let your arms go free. And you can make a little fist to your hands, little fist, and tap. Tap your low belly, tap your back. Feel my chest, chin. Tap your ribs. Tap your chest. A lot of you will remember this from COVID, right? Coming onto the floors and getting you to open your lung energy. Heart, lung. Tap, tap, tap. Tap across the top of your shoulders. Stop. More tapping to come out. Anybody from Cali live here, huh? Cali would love this. So we're going to use the pads of our fingers Again, we're moving the energy. Don't you, does anyone feel different than when we started? Right? What do you feel? Energized. Yeah, because we got all that stagnant energy moving. Yeah? So you're going to take the pads of your fingers and we're going to tap the forehead. Tap, tap, tap. Are your knees unlocked? Are you still breathing? Tap across the top of your head. Tap to the base of the skull, the occiput. Tap in and out a few times. Raise your mind to here. Right? Are you still here? Tap back across the top of your head to the center of your eyebrows. Tap out to your temples. Oh. Breathe. Tap around your eyes. This is really good. You've been on the computer a lot. Move the energy around the eyes. Driving at night. Pull over, tap around. Now let's circle the other way, just so you don't go blind. No, just kidding. And now tap into the jaw. Anybody got TMJ? This is TMJ. Tap around the mouth. Get your serum amylase going, right, for your digestion. Let's tap into the jaw. Let's go around the ear again. The base of your skull. That's the good thing about doing these. I think it's one of my favorite stuff. A little clarity, right? You've been working a lot. You have so much swimming in your head. Do a little tapping. You'll have a little clarity. You'll go into the next meeting. A little clear. Things aren't jumbled. One more tapping. Arm up. Any arm. Arm up. Flat fist. Tap underneath the armpit. Give it a nice thump. You can use the flat hand if you like. These are really common practices to do before any martial art warm-ups. So you're going to come down to the ASIF, the hip, come to the midline of the lower belly, come up the center, come to the middle of the chest, watch your badges. Come across the chest, put your palm up, come down the front of your arm, palm down, back of the arm. These are all the energy channels. Colon, heart, wipe it off. Other arm up. Really good for breast health, lymphatic drainage. Come down, digestive health, lean energy. Coming down. Oh, genitourinary stuff. Right in here. Yes, yes. Up here, any GI stuff? Yeah. I hear it. Little gas, tap around. Just had that pizza, all that cheese. Center midline, right in between the. It's true. Nothing new. Not saying anything. Right here. Oh, your emotional center, right? Some practices, right? Some religious practices, right? Tapping, right? So, something on your heart. Across the chest, heart, lungs. Heart issues, lung issues, you got some asthma, you got some congestion, tap away. Palm up, front of the arm. Back of the arm. And out. And out. All right. So we're going to go on to some yoga poses now. And Allison's going to pull up a chair to show you. You can sit or stand when you do this. If you'd like to go on the floor, no, not here. But this is traditionally how it's done, right? When on the floor. Yeah, that's good. So the benefits of yoga, you guys do yoga, maybe yes, maybe no, warms the body, brings flexibility to the body, opens the chest, stimulates the kidneys, the adrenals. This particular yoga posture, we've done it around the nurse's station. You do it with one person, before you know it, other people are showing up. So if you're sitting down, like Allison, feet flat on the floor. I'm going to stand. You could do it on the back of the chair. If you're at the nurse's station, you could stand behind the nurse's station. And you're going to just slowly, again, breathe. You're going to bring your chin to your chest. You're going to round your upper back. Round your mid back, your low back. Pull that belly button all the way to the spine. Breathe from the base of your skull to the tip of your tailbone. Now push your tushy down. Start bringing your belly forward. Keep your head down. And up and stretch, looking up towards the ceiling. Now the yogis will say this is the exhale. And this is the inhale. I like it the other way. So breathe how you feel comfortable. Inhale, exhale. Head, shoulder, low back push. Tuck the tailbone, push the belly forward. One more time on your own without me saying anything. Find your breath. Inhale. I left one out because of time, but if you see me around the units, you want to do some rooting with some movement, I'm happy to do it with you, but to get the rest of the presentation in. So thanks for letting me work with you.
Hi, everyone. I'm Cynthia. I am from Patient Family Centered Care. I work in the emergency room, and I'm here to bring you some aromatherapy to help you de-stress and relax. So aromatherapy is defined as the art and science in using essential oils to basically relax, balance, and sometimes even stimulate the body, mind, and soul to improve your overall health, your well-being, and your hygiene. I love this quote. It says, "Why do essential oils work?" So oils perform many of the same functions in plants as they do in us. Thus, they come to us as experienced and trained agents for health and healing. So basically, by a show of hands, is anyone familiar with essential oils? Yeah, okay. So they're taken from different flowers and roots and leaves. And it's pretty amazing what they do for the plant. Like they're the immune system for a plant or a tree or what have you. We're taking that immune system and we're using it to help us. So it kind of just reframes why we use essential oils and how amazing and powerful these agents can be. When we use essential oils, we'll go into the few different ways to use them, but I thought it was really important to recognize that when we use them, it only takes about 3 seconds from when you inhale. They find it immediately in your bloodstream, so it circulates through the body pretty quickly, reaching your heart, liver, and your thyroid. And once you breathe it in for a little while, they'll stay in a normal, healthy system for about 3 to 6 hours. So not only that one inhalation, you think you're getting it just like right in that moment, but that is going to have a lasting effect for a few hours, keeping you calm and relaxed. So there are 3 different ways that we can use essential oils. Here at North Shore, we only use the personal inhalers, which Christine helped pass out. The reason why we use that for ourselves and for patients is because it's very personal and the scent just stays, individual to you. But at home, you can use these other options topically. So some of the oils are characterized as hot oils. So you're going to use a carrier oil. So you could find it in different lotions or coconut oil. And a great spot when you're using topically is on your foot. I use it on my kids' feet all the time. I use lavender and cedarwood on their feet. They often giggle. It's part of like the bedtime, like settling in, but the feet is a nice area for the oils to absorb. There's larger pores. So again, you could use them in the little inhalers, or there's lots of great diffusers on the market right now. You put a few drops into a diffuser and it will cover your room or span part of your house. And you can ingest them. There's different companies that have products with these oils and pills or to add to your tea or water. So we made available 2 inhalers that we'll pass out in a little while. So lavender and peppermint are the 2 we're gonna teach you about today. Lavender, I'm sure you've seen spread around by our team Lavender from time to time. Lavender is one of the more popular, more well-known for relaxation. When you diffuse it, it's very calming. It's got such a nice aroma to it. It's natural. It has an antihistamine property to it. It really helps support sleep. It helps reduce stress just by guiding that kind of different sleep patterns and relaxation. It helps with depression. And it's also been shown to help with agitation in dementia patients, actually. And my favorite is peppermint. A lot of different essential oils, especially peppermint, can also trigger like memories for you. So we're just coming out of the Christmas season. Peppermint smells a little bit like candy cane, so it kind of like reminds you of Christmas. So it kind of like makes you happy. So there's different properties that essential oils can bring to you. But one great thing that peppermint does, it's very good for like the GI system. So I know there's a lot of stomach bugs going around. Peppermint is really good just to use an inhaler to just take a deep breath. It really helps with the GI system. It promotes bowel function. It helps with any sort of nausea or or any sinus or nasal congestion. It helps promote mental alertness, some focus and memory. The other great component that I like about peppermint is it has a component of muscle relaxer. So it kind of just helps you pull your shoulders a little bit away from your ears. It just helps relax your muscles, and that makes you feel a little bit less stressed and puts you kind of in a more relaxed state. Athletes use it for performance. A lot of people use this during COVID when they were losing their sense of taste. Peppermint really helps bring back that taste when it was lost at the time. But it's also known to be a stimulant. So you don't want to use the peppermint closer to bedtime. You'll use the lavender to sleep, but peppermint more during the day. So these personal inhalers that we're going to make available to you guys, I'm sure you've seen them before. You want to just use them with intention, use them to, help you relax, help you de-stress. You don't put them directly into your nose. They're not like those Vicks little inhalers they had back in the day. You're just going to unscrew the top. You're going to take a few deep breaths. You breathe normally. You could even use one of the breathing techniques that Nancy showed us. And remember that this stays in your system for a good 3 hours. So you do a couple of deep breaths with your inhaler, and then a few hours later, you can do it again. I like leaving mine in the car. So after a shift on your way home, if you have like the lavender in your car, it's nice to kind of just reset, take a few nice deep breaths of the lavender. It kind of gets you ready to shift gears. Or even coming in, if you use the peppermint will, relax your muscles, but get you more like stimulated for work. So they're easy. You can carry them in your pocket and accessible. We're working on expanding our policy to have a couple of more essential oils available to both you guys and our patients. Right now, we're limited to like about 5, but we're looking into others that might benefit with less contraindications for our patients. Any questions? Or what's next, Allie? I'm going to pass it back to Allie.
Thanks, guys. So I'm just going to sum up the presentation. I'm going to do a little active stretching with you. We're going to do something that's on the chairs. We're going to focus a little bit more on lower body since we did a lot of upper body stuff. Just do a couple stretches. This will actually be good. So say you have a minute, you're sitting, maybe you're charting, and you can sit on a chair. This is something that you can do. So we're going to do 3 little exercises. You guys are seated, which is great. So what we're going to do, always like to engage my core when I'm sitting, because why not? Everyone loves a good exercise, right? So we're just going to say, just really always engage your core the whole time. You keep your hands just right on your lap, and just focus on calf raises. Up on the toes, holding for a second. Just focus on your breath. We're just going to go and breathing exercises we did earlier in the presentation. Just coming up and down. Go over the feet. Right on your side, and we're just going to march the knees up and down. We're working our lower abdominals. Everyone always wants to work those. That's the most question I get all the time doing a personal trainer is, how can I work my lower abs? So this is actually a really good exercise for that. So you're just marching in and out. Sitting on the computer, you do that. Up and down. Do one more each side. I'm good. So we're gonna make a figure 4 with the left, with the right leg to start. A lot of us have a really tight hip flexors. Just for doing the same exercises, either sitting in the car for long periods of time, standing for long periods of time, get really tight hip flexors just in general. So we're gonna make a figure 4 with our legs. No matter what your level of flexibility, you can put it up a little bit, wherever feels comfortable for you. And what I'm gonna do is I'm gonna take my right hand and I'm gonna put it just right on the inside of my leg. I'm just gonna push down a little, just a little bit of assisted stretch. You're gonna feel the stretch on the outside of your leg, right? That's the hip flexor area. So this feels really, really tight. We're just doing this for a few seconds, again, while you're turning. And just sitting and just pressing for a couple seconds. Then we're gonna switch. We just do the other side, 180 it out, right? I'm just gonna press down a little bit. A little less stretch. Seconds. Just gonna do one more time each side. Right? Push down. Also gets that rotation of the hips. Side too. Let's take a deep breath in and through your nose, arms above your head. And look at everyone just to breathe out or push aside any negative energy you have today. You're gonna brush inside. So there's just a couple little extra stretches you guys can do while you're seated. I know you guys are not seated most of the day, but when you do have a couple of seconds, then you get some really good exercise to do. So that pretty much sums up our presentation. I do want to let everyone know all this information, especially the information that Natalie talked about, is available on our playbook that is available on the North Shore page on the internet. So if you guys have questions, that is updated all the time. I left my card in the back. Natalie's card's in the back. Patient Family Center Care is always here for you. If you have any questions with wellness,
I think they're